Hello, this is Josh, live from San Marcos. I'm sitting with Dennis and Emily. They're student physical therapists from the University of St. Augustine, and from what they're telling me, recently they've been diving into a little bit of research concerning different types of interventions that physical therapists use towards their various patient populations. Specifically, we're going to be talking about a study concerning trigger point therapy geared towards patients with fibromyalgia. So if you wouldn't mind giving me a little bit of insight as to what the study was about.
Yeah, sure, Josh. So myofascial pain syndrome is one of the most common musculoskeletal pain diseases and is characterized by myofascial trigger points. These trigger points are an important factor in the genesis of fibromyalgia syndrome and is important to us as clinicians to understand the best evidence-based treatment approaches for these patients. This study was a single-blind, randomized trial aimed to compare the effectiveness of dry needling versus cross-taping on spinal mobility and myofascial trigger points in spinal muscles in patients with fibromyalgia syndrome.
Sounds interesting. So you can use needles to help treat some different pain syndromes for patients?
Yeah.
Awesome. Okay, so concerning different studies, from what I understand, there's different types of validity that gear towards how strong of a study that was conducted and how well it accurately tests what it's trying to test. So it's the amount of control from all the sources within the study, and you have one that's internal that gears towards the specific variables within the study, and then you have the external validity which gears towards the generalizability towards the population base that the intervention is going to be used for. So Emily, if you could give me a little bit of insight as to the different threats to these validities of the study.
Sure, Josh. So this study randomly assigned their subjects, therefore the threats to internal validity was ruled out. Normally when internal validity is increased, the external validity is lowered.
Oh, so it's kind of like an inverse relationship?
Yeah.
Okay, awesome. So Dennis, if you could tell me about some of the strengths of the study, like what makes this study like highly qualified, so to say.
Sure. So 59 out of the 64 subjects were female, representing the prevalence of fibromyalgia in females greater than males, ratio being 7-to-1. Dry needling and cross-tape therapy were treated in isolation, whereas normally in clinical practice, multimodal approaches are commonly used for treating fibromyalgia symptoms.
Okay. So because of that 7-to-1 ratio where women are more affected than men, because the study chose to focus on the interventions towards women, that makes it more generalizable and therefore the external validity is a bit stronger, right?
Mm-hmm.
Awesome. So concerning, some weaknesses where the study was maybe not as, foundationally strong, Emily, if you could let me know a little bit about that.
Yeah, there are a couple of weaknesses. One of them is that the outcomes were not collected over a long-term follow-up period. And then secondly, there was no control group that did not receive any treatment because both groups received a treatment.
Okay. And I think I studied once that if there's not a control group, it's considered a quasi-experiment.
That would be correct.
So it's not like a true experiment where there's a control group.
Exactly.
Okay, excellent. So then kind of zooming out a little bit in how this study can, be applied towards the patient population, could you tell me a little bit about the effect size?
Yeah, so in this study, dry needling and cross-tape approaches reported a similar effect size for spinal mobility measures, with the exception of dry needling in a seated position, where dry needling showed significant improvement.
Awesome. And then zooming out one more step, so to say, is, again, the application in clinical practice, like what's the take-home points? Can you tell me like that last little bit of summary here?
Yeah, Josh. So four-week dry needling therapy significantly decreased the number of myofascial trigger points in comparison to the cross-tape group. It also showed a major improvement in pain intensity. It increased local tissue blood circulation. It generated local stretch on cytoskeletal structures and caused relaxation of the sarcomeres. Dry needling trigger points with paraspinal muscle dry needling was more effective in reducing pain than dry needling on trigger points alone.
Awesome. So overall, there's definitely some benefit towards the use of dry needling with those types of patients. Well, thank you very much for your time today. I appreciate you coming in. And for those of you listening, I hope that this information is going to help you out with your conditions if trigger points are causing some problems in your life. Thank you very much.